Well, in order for you to understand how advanced orthogonal chiropractic can help you, it's important that you understand the basics of body function. You're designed where your brain has all of the programs that run your entire body's health. And it sends those messages down the spinal cord, out the nerves, controlling every single part of your body. Your brain tells your heart to beat, and your lungs to breathe, and your stomach to digest. All your body functions are brain controlled. Your brain also controls all your muscle groups. But your brain controls all these, like I said, by sending the messages down the spinal cord, out the nerves. This system is protected by bone. Okay, your brain is encased in the skull for protection, and your spinal cord is encased in vertebrae. But it's not one long tube of bone, or you wouldn't be flexible. So they're pieces of bone that are stacked one on top of another, and they're bendable and movable. But because they are movable, they can get moved out of place. Now, people know they can get moved out of place, because if you get a vertebrae completely dislocated and it cuts the spinal cord, that dislocation could be in the neck. But the entire body is robbed of nerve supply and it goes paralyzed instantly. So people know that vertebrae can get out of place and cause problems with the nervous system. What we found in you is you have a dislocation of the very top vertebrae in your neck called the atlas vertebrae. And when that vertebrae gets partially dislocated, it doesn't cut the nerves or paralyze you, but it does cause interference on the nervous system. And people can pick up on this different ways. Patients might notice one ear isn't as good at fighting infections as the other, and therefore they have ear infections. Or they have one lung that's more vulnerable to pneumonia than the other side. Or they have one arm that's not as strong as the other side. They have these imbalances, or maybe they have pain on one side of their body. Those are all symptoms. But the actual cause of the problem is the interference. So where we come into play is we analyzed your spine the other day when you were in for the examination, and we found that you had an imbalance of nerve supply. You had discrepancy of strength issues, your back was twisting, and we found a swollen nerve in your neck. I mean, those findings are very important for us because your body wasn't functioning right. It isn't functioning right. So what we do is we intervene to realign your bone structure, put the atlas vertebrae back in place so the body can start to heal like God designed it to. Now, the key to your recovery, though, is not us adjusting you. Because I want you to understand one very important concept. Most people don't get all damaged from getting out of alignment. They get damaged from staying out of alignment. So my first job is to teach you that the longer you stay out of alignment, the more damaged your nervous system is going to get. Because the longer that you stay in alignment, the more you're going to actually heal and recover. Which means it's not me adjusting you that gets you well. We'll put the bone structure back in place so the nerves can function right, but it's your holding the adjustment that is the key to recovery. Not coming in to get adjusted all the time. Holding the adjustment. So the obvious question you're probably asking is, how do I hold the adjustment? Because every patient asks the same question. The two main things required for you to hold the adjustment. Number one most important thing has nothing to do with you. It has to do with how accurately we fix you. The more accurately we reposition all the structure and get you into proper alignment, the more likely it is to stay put. And we'll show you in just a moment on the x-rays what we do to be accurate. The second thing, we're going to give you some instructions how to be careful with the adjustment, though, because you do have to be a little careful with it initially while the ligaments and muscles are trying to stabilize and hold it. But the better you hold the adjustment, the faster you recover, start feeling better. The better you hold the adjustment and stay in alignment, the more long-term your results are going to be. And the better you hold the adjustment, the less you have to see us, which is a very nice feature, because we want to get you holding, get you recovering properly. So what do we do to actually get you fixed? Well, first of all, if you remember, we took some x-rays on you the other day. We took those x-rays from 3 different perspectives. We took one through the front, and one through the side, and one through the top. And we x-rayed you on each angle, each dimension of perspective, to find out the exact coordinates of misalignment. We use a mathematically based procedure for analyzing you. It's not opinion. There's no experimenting or trying things. We measure you on the exact coordinates that you're out of position. We mathematically conclude the exact coordinates to correct you. And we take those coordinates and we plug them into our sound wave adjusting instrument. It's a sound wave. It's not traditional manipulation. It's a percussion force. You won't even feel it. There's no discomfort with this procedure. And once we make the correction, immediately the atlas is realigned, the nervous system is cleared, your body starts to untwist and things start to balance back up properly. And we'll point that out to you as it's beginning to occur. So after the initial correction, we're going to be re-x-raying you immediately, through the front, through the top, re-measuring to make sure we corrected it properly. At that point, we have scientific evidence confirming that the treatment did exactly what it should have. It lets us know if there's any modifications we need to make to your adjustment to get you even better results. And at that point also, we start to move our mindset into holding the adjustment. And that's where we'll give you the instructions on how to be careful.